Violence against children is a huge problem for societies. Social workers are already working very hard and they have very large caseloads and they probably feel overburdened and burnt out. It is not just the physical and mental health consequences, but there's also an economic cost because people who experience violence are unable to work, are more likely to die early, and are much more likely to be ill and not contributing to the economy. When we're talking about violence against children, we mean all types of violence. So we're meaning child maltreatment, which is imposed by parents often or other caregivers, by people in a position of power over children. And it can be physical, emotional, sexual, and it can be neglect. So forgetting to take the child to the doctor when they have medical needs, not providing food or drink, not providing them with clean clothes when you could. So the importance is that you could. Not that you, for financial reasons, cannot. Then we see a lot of intimate partner violence, which is violence between young people who are dating or between young people who have been dating. And that can, again, be physical, emotional or sexual. Or it can be economical, where one partner is withholding monetary means in order to make the other partner more dependent. And then we see bullying, which is violence by children or groups of children directed at a child that they're not related to, which is very important, and not dating. And they're repeated incidents that have the potential to cause harm. And then we also see youth violence, which is typically assault between groups or individuals. In South Africa, there's a lot of stabbing and gun violence. And it can also be gang violence, so groups of young people or individuals of groups that are being violent toward each other. And when we look at the prevalence rate across the world, so this is not something that is specific to South Africa, so there are high prevalence rates across the world. There are very high prevalence rates, particularly in low and middle income countries. And we see in South Africa about 35% of children in the latest nationally representative study that was conducted by the University of Cape Town report that they've experienced physical abuse in the past year. 16% have experienced emotional abuse in the past year. About 10% experienced neglect in the last year. We see about 10% that experienced sexual abuse in the past year. And 50% have been exposed to community violence. So there's very high numbers of children that experience violence within their, not in their home, but outside of their home, in the immediate environment outside of their home. It's a really good question. I think it's a tricky question because social workers are already working very hard and they have very large caseloads and they probably feel overburdened and burnt out. And it just feels like an unsurmountable mountain that is in front of them, that is very difficult to climb. And I think what social workers can do is they can start working with the most vulnerable. So children that experience multiple types of violence are the most vulnerable. So we know from research, particularly in high-income countries, but we're now seeing it also in our data replicated in South Africa, that the more types of violence you're exposed to, the poorer your health outcomes. So children who are, for example, HIV-positive children who are not taking their medication, the more types of violence they're exposed to, the less likely they are to take their antiretroviral medication, which has long-lasting health consequences. Children who are experiencing multiple types of violence are much more likely to have attempted suicide, to have thought about suicide, and to have planned suicide. They are much more likely to be using substances. They are much more likely to be drinking too much alcohol. They are much more likely to be perpetrating violence. They're much more likely to be victimized again as adults over and over again. And they're much more likely to have poor sexual health. So there's a whole host of reasons why we should be focusing on particularly these children who are experiencing multiple types of violence. As a social worker as well, I think we often focus on responding to child abuse. So it feels like you're a firefighter that is always running after the next fire, but you're never really doing anything to prevent the fire. So you're not taking the matches away, you're just running around. And the government very clearly lays out in its legal provisions in the Children Act that that there should be child abuse response services should be provided, and they very clearly should be provided. But there should be a move from only focusing on response and crisis management to prevention. And I think a lot of social workers are not really aware of this, that there is this legal provision and that they really should be working towards that. Because if we are preventing violence, and we can prevent violence by multiple fairly easy means often, by making communities safer, by making sure that the legal provisions are implemented, by making sure that we give parents tools to deal with their children's behavior so that it doesn't escalate, so that they don't have to respond in a violent manner, and also to improve family relationships. Then I think if we are doing this and we're using evidence-based methods to do that, because the resources are limited, so we should really be focusing on things that have been shown to be effective, also in a South African context. Then we can move towards a prevention service. And what we're seeing very clearly come out of all of the research is that child abuse victims do not seek services. Very small numbers of children who have experienced horrific instances of violence go and seek advice from services. So evidence-based interventions are interventions that have been tested using rigorous designs, ideally in multiple contexts. So by rigorous designs, I mean randomized controlled trials or quasi-experimental studies that are of high quality, to test whether the intervention actually has an effect on the desired outcome, and most importantly, to test and ensure that the intervention does not cause harm. Because in social service, I think the utmost priority is that we are not causing harm to our clients. And what we're seeing emerge throughout 50 years of social work history is that many interventions that were done with the best interest of the potential clients at heart actually turned out to be very harmful. The University of Cape Town, the University of Oxford, the University of Reading, the University of Bangor, in collaboration with UNICEF, the World Health Organization, have collaborated to design a child abuse prevention program for parents with teenagers and a child abuse prevention program for parents with children. And both of these programs have been rigorously evaluated in the South African context. And both of these programs, they are not perfect, but they have shown significant decreases in child maltreatment in families, and they have particularly shown significant increases in parent-child interaction. They're promising interventions that have been tested in the South African context. They're both freely available from the World Health Organization website. You can find the manuals for these interventions. They are very low cost, so they can be delivered anywhere. The manuals are available and everybody is free to download them from the website. We would recommend that the people delivering it should receive training. The Good Schools Toolkit, which is an intervention that was developed in Uganda, helps teachers to develop skills to deal with discipline in ways others than using violence. That is available for free from the Raising Voices website in Uganda.